There you go. Hi, everybody. It's Dr. Patricia. How are you? I'm just going live here with Natasha for our live at brunch and just making sure that everything is streaming well. Hi, Natasha.
Hello, Patricia. How are you?
Good, good. So nice to see you.
Yes, you as well. So happy to be here with you today.
Oh my goodness. I'm really excited to have you here because this talk, I've been really looking forward to this talk because root causes of imbalances in the body is so big in functional medicine. And I'm so excited for us to kind of dive into what is the Ayurveda perspective on it, and to be able to do our usual kind of riffing off of each other's comments and to augment our learning in that way, like, because we learn through teaching too, right? So I think this is going to be amazing for not just our listeners and our viewers, but also for us as two healthcare professionals who are so passionate about helping people, like, and in this Facebook group, Wild Wisdom for Women, helping women in particular, really identify what are some root causes in their imbalances so that they can reverse it, right? And some people do need medications to get the energy to then go and reverse it, but we should be able to, reverse a lot of the things that we're experiencing, the imbalances that we're experiencing. So thank you for joining me today. I really, really appreciate it.
Yeah, thanks so much.
Now, what we're doing here is we are live, so I'm just going to make sure that the comments are working. I see we have some viewers. So if you're joining us live today, please, it would be so wonderful to put in your name and where you're calling in from into the chat. That allows me to see you and acknowledge you. And also, if you have any questions, please feel free to ask your questions. And it also lets me know that the chat is working. And that would be really great as well. And what I'll do is I'll also go onto the Facebook and see if I can see the chat through there. Yep, here we go. So I can also see the chat through here. So I'll just monitor it just in case there's a funny, like, it's working through Facebook, but it's not working through the chat. All right, perfect. So Natasha is not only a dear friend, a long time friend. We were friends even before we began on this particular journey. Oh, Donna from Saskatchewan, good morning. Oh, lovely. Thank you, Donna. That's so wonderful for joining, and so helpful to know that this chat is working so I can put my phone down. Perfect. That's awesome. And we've been friends for a very long time. And then we both became very interested in helping women. It's kind of through our own journeys. And Natasha's journey was through Ayurveda. So Natasha is a certified Ayurveda and yoga teacher. And she has so much knowledge. And what I love is she has a very, you have, Natasha, a very interesting skill set, because you were an engineer. So you had a very analytical, rational, that kind of mind. And then you went into yoga, which is so beautiful and creative and has a science behind it, in kind of like a very beautiful, creative kind of context and structure. So I always find that your explanations are so wonderful. And today we're going to be talking about root causes of imbalances. And in functional medicine, which is, I'm a specialist in physical medicine, certifying in functional medicine, it's all about learning the why. Oh, my hormones are imbalanced. Why? Oh, I'm getting fatigued. Why? My skin is erupting. Why? I'm having terrible menopause. Why? Right? So that we can then go in and fix it. Because if you don't ask the question why, you can't figure out the root causes, often it's more than one cause, then you can't fix it, right? You might accidentally fix it, like, wow, amazing, I did this thing and wow, look at that, got fixed. But that's very rare. It's usually intentional. Is there anything else you would like to say, Natasha, or do you want to dive into sharing your wisdom?
Yeah, I guess what I want to kind of preface by saying is today we're going to offer you some ideas and things to ponder. I mean, in a 30-minute Facebook Live, we're not going to get to the root cause of your imbalance, who's watching specifically, but we're going to give you a lot of things to think about. And that's what we want to do, is get you to start thinking about your own health and reflecting on yourself, your habits, your diet, etc., and see where these tips can kind of be incorporated or maybe thought about a little bit more to see if they resonate with you.
I love it. And it's a good reminder. Yeah, it's getting to a very, like, each person has their unique body, their unique circumstances, their unique kind of like journey that got them to their imbalance. And so we have to give, like, by necessity of the time and the context, we're giving a general overview that will still be very helpful to start to reflect on what might be, like what Natasha is talking about, what I'm talking about, reflect inwards, like how could this be related to my current circumstance?
And as you were saying earlier, Dr. Patricia, it's like you have something wrong with you. You're showing a symptom. And so a lot of folks will just go online and Google their symptom, and the internet will tell you like 5 different reasons why you're getting this like flare up acne or indigestion or IBS, or name the imbalance or the way the body kind of speaks to you and tells you, I'm not really happy, and I'm not going to let you like just relax and enjoy your day until you deal with what's going on inside here. And so we want to get it done and over with right away. And sometimes we just go to like, what supplement can I get? Or like, what medication can I get? Or like, what like perfect food can I get that I'm going to eat a bunch of and it's going to make me feel better? And when we do that, we kind of like just scratch the surface, and we're not really looking to find out like, why did this happen in the first place? What generated this? And often when we get to an imbalance, the imbalance started long before you start to feel the symptoms that are so loud that they're speaking to you. And so it takes a little bit of working and digging to kind of figure out where that root cause is coming from. And as you mentioned earlier, Patricia, that I am an engineer as well. And so engineers love puzzles. So Ayurveda was this beautiful introduction to me, because folks come to you and they've got all of these different puzzle pieces, and you have to kind of put them together to see the big picture. And you really have to dig down and discover and analyze. And so we're going to ask you yourself to just go into your own like experimental like lab and like do your own assessment and take this information and kind of dig in to see what might it be. And this is going to take some reflection time. The hard way to do it is to trial and error, right? The hard way is just to like take something the internet says and try it, and then take something else and try it. And it does take more work to think about it, but that's the way that we're going to get to our root cause.
Oh, I love so many things that you said. Just highlighting that you said that when the body speaks, the body language starts to tell you that something's wrong. It'll like be gentle at first, and then at the end, it's like screaming. It's like, pain, inflammation, swelling, digestive is like crazy, like it maybe even be like Alzheimer's, dementia, MS, like thyroid conditions, right? And so it's like being able to pick up on that body language, even ideally, and you're right, like the imbalances start before the body language starts. Like Alzheimer's, for example, is now shown to start around the age of 40, even though it's only around the age of 50, 60, 70, 80, depending on what kind of Alzheimer's you get. There's more than one kind. So what you're going to be, when you're listening to this, if you're a person who's healthy, right? If you consider yourself to be healthy with no imbalances, really pay attention, because if you're aware of what root causes can happen, you can also work to avoid them. It is much easier to maintain health than it is to regain it. And you can regain it. Like even Alzheimer's has been shown to be reversible by Dr. Dale Bredesen in the US, but it's heroic efforts. Like it goes from like some, daily habits to like a whole life, right? So Natasha, why don't you take us into the world of root causes according to Ayurveda wisdom? I'm so curious about this.
Yeah, thank you. My internet was a little bit unstable while you're talking, so I hope I didn't miss anything important, but
I
I'll
didn't
just
say
dive in.
anything important.
You always say things important. I love every little nugget. So when you bring Ayurveda and yoga into the picture, a lot of times our root cause is found in our mind. And that's a big topic. And I love, and for folks who are listening, if you haven't seen Dr. Patricia's talk on the science of manifesting your health desire, that is the one to go rewatch, where she talks about what I'm just about to get to dive into right now. And we're going to start there, and then we're going to come out and give you more tangible ways to look for the root cause. But the more people I've worked with, the more research I've done, the more I've even dug into my own, my own health. I feel like a healthy person, but there's these things that are going on. I realize that it's the mindset. I realize that, if we are reaching for that food that's not helpful for us, like the fast carbs, etc., it's usually the mind, that is generating a thought of loneliness or depression that is leading us to go get this comfort food, as an example. If we have like a very like mobile and erratic schedule, and it causes like that mobile quality, and our mind is spinning, and then we are thinking too much, and the anxiety comes up, and then we want to pacify that anxiety with like a sweet thing. Like, so we want to grab something that's going to like ground us down. And so we might grab a certain food, or maybe we're just go. And then those thoughts are sort of like generating that mobile quality in the body, which is causing like more imbalance. And so often, where does that thought generate from? Why do we choose to have that erratic schedule? Why do we have those emotions of depression, sadness, loss? Why do we want to have control over a situation? Why are we so attached to a certain outcome? Where are those thoughts coming from? Because when on the attachment side of like the wanting to control an outcome and being perfect, and like a fear that you won't be loved if you're not perfect, these are ways that you're kind of digging down into a root thought or storyline or narrative that you believe, that is generating your present thoughts that are making your choices, that are then further imbalancing you by, how you're acting in a situation, or what food you're grabbing, or what you're doing with your habits.
Woo, that was so good. I love that you went straight to the mind, because, and I'll put this into context, I feel like you were talking to me, because the last week, it's so interesting. Like there's like people who don't quite know yet what to do to be healthy for their unique body, right? And I feel like I know what I need to do for my unique body. I've done a lot of learning, a lot of exploration. I really know myself. And this last week, I found myself reaching for like a lot of sweet things. And it's so interesting, because yesterday night, I was sitting there and I reflected on my behavior, and I was like, why am I doing this? Because I know that if I keep doing this, I'm going to imbalance my hormones through the sugar, my blood sugar, right? I'm really not managing my blood sugar. It's going to throw off my insulin, my estrogen, testosterone, progesterone. It's going to be nuts. Like, I know I've been through it before, right? So why am I doing this? Even though I know. So, if you are experiencing this situation, just so you know, like, so much compassion and empathy, because it's really easy situation to find yourself in, especially if you haven't developed that self-awareness. And even for me, like, I think of myself as being a very self-aware person. I still fell into the trap, and I realized it's like I'm kind of going through a little bit of overwhelm. I'm moving homes, or renovating, I'm running a business, I've got my 2 kids, you know what I mean? It's like, just like, I literally feel like I'm taking on the job of 4 people. And I am. And so I was starting to feel overwhelmed, and it's like, oh, and so what did I do? I started reaching into my toolbox. What's my toolbox for coping with that kind of stress in my life? It's like, okay, first I'm going to change my perception, right? I'm going to change my perception. So instead of feeling like a bit of a victim, like, oh my God, I'm so tired, I have so many things to do, I have so many things on my plate, like I'm doing so much, this is so hard. I kind of just changed my perception of the situation. And I was like, wow, like, look at me, look how empowered I am. I am amazing. Like, look at what I'm accomplishing. Like, I'm so proud of myself, and part of being strong is asking for help. So tomorrow I'm going to ask for help with this. I'm going to hire someone to do that. I'm not going to do it myself, even though I know I could. Right. So, and so just, it's not that you can change the reality, because you can't change like the way your job is stressing you out, or your partner. Like, I mean, eventually you can, because you can leave the job and you could, get marital support, or support, like relationship support with your partner, or take parenting lessons. I don't know. However, in the moment, like, you can't immediately change a situation very commonly. So, but the first thing it takes is that recognition. And thank you, Natasha, for bringing this up, that what your mindset is what determines your behavior. So thoughts create behavior.
Exactly.
Yeah. So if you're engaged in a behavior that you kind of know doesn't serve you, or you learn doesn't serve you, and you can't let go of that behavior, it's actually, you have to change the thought first.
Exactly. I love everything you just said. And I also admire and love that you do take that time to pause, because often a lot of us are just go, go, go. And we don't take the time to pause and like think about, where is this coming from? And I urge you, everyone who's listening, to maybe make that a habit, that you start to take that pause and just witness. You might not be at the place where you understand it yet, but the witnessing part is such a huge step. And the big question is like, how do you change your mind? Right? So if we do know, and we're witnessing, and we're saying, okay, I do have these thoughts of loneliness, or I do have this overwhelm, or there's really a lot on my plate. And I loved your suggestions about like, kind of switching to the positive, which is so powerful. We want to be careful that we don't want to perpetuate our past into our future. So if we want change, we need to change the mindset. So if we're doing the same things, if we're eating the same foods, if we have the same thoughts, if we're if we're still judging the same people, if we're still stressed about the same situation, then all of that past stuff is going to go right into our future, and we're not going to create change. So how do we do that? Well, not everybody is ready for this deep dive on mindset change. And maybe we're at the witnessing stage. So what I love about Ayurveda is they have all of these tools to help change your mindset through the body. Things that are really tangible that you can do that are going to start to change your mind. So I'm excited to kind of get into these topics and break them down into basically 3 different types of mindsets or personalities, and maybe we can see if one of them resonate with you.
That sounds great.
Yeah, great. So in Ayurveda, we kind of break everything down into the elements, and we have a couple of Facebook lives earlier that we've done where we've talked about introduction to Ayurveda, etc. So I'm not going to get too much into the details about Ayurveda, but I am going to break things down into some elements like air and fire and earth. And so our air element, if you think about the qualities of air, it's light, it's dry, it's mobile, and we can associate with that element in the mind and body. In the mind, we could be light and all over the place, and maybe have like a erratic schedule and be creative and all of the things, and maybe that's our personality type, and maybe we're go go go, maybe we're talking a lot, anything that's going to have a lot of mobile qualities to it, whether it's movement, it's schedule, it's talking, anything that's going to take up a lot of energy. And so when we look at those qualities of mobile, then, what would be associated if we were looking at that quality, what would be associated with an imbalance that would have those same qualities? So if your imbalances are associated with a light, dry, mobile quality like anxiety or dry skin, constipation, those kinds of things,
Osteoporosis,
then
dementia, Alzheimer's,
exactly when we
drying
get
out of
into
the
those
brain.
deeper imbalances, then go to disease, like Dr. Patricia, you're saying, like osteoporosis and Alzheimer's you were mentioning, and
Dementia, yeah, because also osteoporosis is kind of like a drying out of the bone, kind of like a brittleness of the bone. Alzheimer's is like a shrinking of the brain, and so is dementia. So it's very interesting because when we did our Ayurveda workshop, when we were like going deep into that and connecting into that, showing that those would be imbalances towards the wind imbalance, which I found so fascinating.
yeah, exactly. And with mobile, that quality, the variability, sometimes we pass a stool on day one, but then we don't for like 2 days, or then we pass two stools. So that variability, that mobile, sometimes we're up and down, and sometimes we've got lots of energy, and then we like crash. And this variability is another quality of the air element.
Mm.
If you're finding variability in your body, like you have a full period and then a scanty period, and then your period doesn't show up, or maybe you notice it in your digestion, or maybe you notice it in your mind with anxiety, and then being okay, and then really anxious. If you're noticing this variability, then we're looking at the mobile quality. And what's the opposite of mobile? Static. What's the opposite of like being variable? Having a schedule. And so when we look as an Ayurvedic practitioner at someone who has all of these things happening for them, and we're noticing these common sort of uh, things that are happening in their life and their mind and their body, we go straight to routine. We ask them the questions like, what is your daily routine like? And more often than not, they don't have one. They wake up and they don't know what their day looks like. They know that they're going to eat, and they just don't know what's going to happen after that. And when we can start to introduce even bookends of the day, a morning routine and an evening routine, some grounding things that can happen that can really root them down, we notice that a lot of the things happening in their mind and bodies start to calm down as well. So we look for a root cause in a daily routine with those types of imbalances. If we move on to like the fire element as an example, the fire is like hot and passionate and sharp, and yeah, Dr. Patricia, you're smiling, I'm smiling too. It's like that's where we both find our imbalances most of the time, because we are go and want to accomplish and want to achieve, and sometimes what can creep up is that the perfection over just doing it, and also just trying to make sure everything's right and everything's taken care of. And then we can start to get attached to the outcome, and when it doesn't go well, we're like, well, what happened there? How can I be better? And like and all of that, like go, whether it's in your schedule, in your job, in your housework, or in your exercise, right? Some people just exercise and go to the gym and push and push and push. And this hot, sharp, passionate is going to show up in the body as hot, sharp, and passionate, right? So the inflammation, the itises, the acne, the rashes, all of the hot, things. And so when we see these things happening in the body, we then go back to the qualities, like what are the opposite qualities of this hot, sharp, passionate, like want for control, desire, like all of these, like go. What's the opposite? Well, we calm down, we surrender, we play. All of these words are like, oh, I don't know about that. Can I really introduce some surrender in my life? Can I really introduce some play? Can I introduce some cooling? Can I let go of control? And so often with these folks, I'm trying to dig in to their life and see where we can find a place to just let go. So often that's the place where they have a hard time. And the more they don't let go, the more they aggravate that hot, sharp, and passionate in the body and the mind.
Ooh, they're speaking my language, Natasha.
And the third, so we talked a little bit about like the mobile, we talked about the passionate, and now we're going to talk about that dense and heavy. So this is also where I spend some of my time as well. And so if you're feeling that sort of lethargy, dense, heavy, unmotivated, having a hard time getting out of bed, understanding why you're even like doing your day, because, you know, what's the point? And I am very familiar with the depression side of things as well. And what are the qualities of that, right? That heavy, dense, thick qualities that make you sit in front of the TV, that make you scroll with your phone, that make you not want to get your work done, to make you not motivated. And those imbalances can make you feel heavy, dense, and thick, both in the mind and the body. The weight gain happens, the congestion happens, the lymphatic like congestion, the actual like feeling congested, the colds and the flus, you know, and just that heaviness as we talked about in the mind. So the opposite qualities of that, you know, are light and mobile, like we were talking about earlier. But where do we find this? What happens to the folks that are feeling the heavy dense? So they usually end up going to the food. So we talked a little bit about like habits. Your daily routine is often associated with the mobile. We talked about like the mindset and like how you deal with the things that you have in your life. That's more of the fire. Now the food comes in when you're feeling a little bit more down, depressed. That's when you reach for your fast carbs. That's when you reach for your sweets. That's when you reach for all of the things that we're not supposed to be eating. That's on the heavy, dense, thick side. They all cause heavy and dense and thick, right? They are heavy, dense, and thick. And even the sweet taste when it comes to sugar is a heavy, sweet, sort of cooling. It's going to aggravate all of that heavy, dense, thick qualities. So your pasta, your pizza, your ice cream, your like all of those things, even the chips, right? The salty and the oily, that's all gonna like aggravate. Even though there's some crunch there and that's like a little bit higher, it's something you might go to because you're like, I need something light and crunchy, but it's just not the right choice. Because of the other qualities of the food. And so often when I look at someone that has those poor diet choices, they have the imbalances associated with the heavy, dense, thick of the depression and the watching TV and the unmotivated. And it's really interesting. So that's when I go to the diet and I say, okay, here's what we got to do. This one is a diet change for you in order to help bring yourself back to light and bring those hormones back into alignment and all of the things. So these are sort of like the three kind of major categories that we look at. And what you do with your day, how you deal with situations, and the food you eat all have an effect on your mind.
Oh my gosh, I love it because also, first of all, that was amazing, like a tour de force in a very short amount of time, very clearly explained, like I really got it. And again, it helps to give like a personal example where and you can probably do this as well. You know, if you're listening to this and you're kind of trying to find like, where is this fitting in with me? I have a little bit of each one. I have a predominant fire for sure, but I'll find myself, and when I'm well balanced, it serves me, right? It's like that drive, that ambition, that passion. And when I get out of balance, as you say, with like too much attachment to the outcome, that kind of thing, it starts, and then you know, you start to get like, yeah, like some skin rashes and some digestive upset. And then, but I can also find myself like going into the airy, like feeling like a bit anxious, you know. And then I find my routine, like when I established a morning and evening routine, that was like such a game changer. So I don't find myself too much in that, although, and even like my dry skin and my dry hair and my dry bowels, like constipation has really improved with that. And then the heaviness is, I guess, where I've been kind of hanging out with is like a little bit of the heaviness, you know, as you say, just feeling a little bit dragged down by all of the to-dos and all of the things on the plate, and then reaching for something sweet to kind of like pick me up, you know, like a little pick me up. When what I really need to do is like pick myself up in another way. And I found it was interesting, the thing with the chips, because in Ayurveda, my understanding is that you want to eat something that's opposite. So if you're feeling dense and heavy, you're not going to be having like, like if you're starting to get too dense and heavy, you're not going to have like yogurt or, that kind of stuff. You're going to reach for something kind of light and crunchy, maybe like an Ezekiel bread toast or something like that. Potato chips are like a processed food. So they're actually not hanging out in like a whole food solution, and people can reach for them because they have the crunchiness quality, but embedded in the product is like very synthetic chemicals that then further imbalances you in a very weird way. And Ayurveda was a medicine that was established over thousands of years, when what we had available to us was whole foods as medicine. So I think some of us are like intuitively self-medicating with something that is like your body kind of sometimes reaches for the thing that it needs to balance itself, like something light and crunchy, but the processed nature of it really like throws us for a loop, like even
Yeah, absolutely. I was noticing it myself too, because as I mentioned, I can tend towards that heavy. And so I was like, oh, I really want some chips. And I went to the store and I bought myself some like snap peas, like sweet snap peas, because they're crunchy. And I was like, yes. So I brought them home. And then those times when I'm like, I would just grab them and crunch on all of these like beautiful, crunchy, like sweet peas. And it was so satisfying. So that's what we're talking about, is like leave the chips at the store, bring home the crunchy, like sweet peas, and have those as your snack.
Oh God, yeah, you know what? I need some like crunchy carrots or jicama sticks or something like that.
Yeah. Love it.
So true, so true. That was really wonderful, Natasha. And I think that it's a really like, that's a lot of great information for people to mentally digest. I'm trying to think of like, we can, we can dive into another topic, which will take us for like another half an hour, or we can sit with this, which is kind of my inclination right now, because here's the thing. In functional medicine, I'm going to kind of tie it into functional medicine, because that's what we love to do, is like marrying the Ayurveda with the functional medicine. Is like functional medicine and medicine in general focuses more on like the behaviors. So you can kind of group root causes into like things that were like unintendedly as a result of actions that you took. Like you ate the foods that weren't serving your body, you ate foods that imbalanced your hormones, you drank alcohol to an extent that your body didn't do well, or you smoked this, or you overscheduled yourself, and you're not managing your stress well, right? So those are kind of things you can do. And what you just did is gave a higher level overview of the mindset that then can alter the behaviors. So that's like an even higher overview, which I thought was beautiful. And then there's the realm of like root causes for things that it's just dumb luck, like toxic mold exposure, or like a heavy metal exposure, or you have mercury amalgams and you happen to be super sensitive to mercury and it just doesn't do well with your body, right? Like those are things that it's just dumb luck, it happens, or you live by like a very heavy EMF exuding tower, maybe you're beside like a satellite dish, that's very strong, and it's just what happens to be where you live. Those are things like root causes that can contribute to imbalances. And that lives in the realm of like, learning about those things and figuring out the actions. And then your mindset kind of comes into that as well, because here's what I see. Some people kind of find out that they have an issue, and it could be related to a mold toxicity or mercury amalgam, intolerance, or whatever you want to call that. And then it's like, what is the behavior around that? Are you going to take action, or are you going to become paralyzed? Like, I don't know what to do, so I'm not going to do anything, or I'm going to be very, very stressed out by this. And I'm going to be even more stressed out by the situation and not take action, right? Or, do you see what I'm saying? So it's like, and then having the mindset to be like, okay, you can't be pulled down into the heaviness of the situation, right? Or don't go into the lightness of anxiety. Like, don't let that cause an imbalance of anxiety or cause an imbalance of depression and heaviness. It's rather, okay, find the balance, like appropriately be really like, I don't know, like be like, oh man, this sucks. Like, why did this happen to me? And then pull yourself out of the heaviness or the anxiety and just focus in and take action on what needs to be done. Like, do your homework, find the experts, work with the experts, do the lifestyle changes, do the detoxification. Like, you know what I mean? So, like, when I think of root causes, I kind of think of them as these very two big general categories. And what you just spoke to in Ayurveda really is like the root cause of the behaviors, and then like the root cause as to why, despite the knowledge of some imbalances in our life, we can't take action on it, or we take the like you know what I mean, like we take like the wrong action where we get anxious and or depressed or both.
Yeah, and what I would love what I do love to dive into is the why. You know, when something does happen or when you do learn and you have that reaction to it, you have the anxiety or the depression or the no hope or all, like, why do you have that reaction?
Yeah.
What generates that root reaction? And as we started with the mind, and that's my favorite place to work with my clients, is digging into the origin of the thought generation of whatever is happening, and where did that actually come from. So I think it's fascinating, and I do love that you brought in like the tough luck parts. And also with both functional medicine and Ayurveda, if you are in that situation, there is hope, and there is people to reach out to, there is information to get, and there is a change to make. And often when we do find ourselves in like these deeper diseases, we feel like, okay, like there's nothing I can do. I just have to listen to like what people are telling me. But there's always things that you can do in your diet, in your lifestyle, and in your mind that is going to traject you to a healthier place, even with a diagnosed disease. And in a lot of cases, actually bring it back. And I think it's important to know that our diet, lifestyle, and mindset are really big factors when it comes to our health. And we can make those changes without anyone else, without an additional outside source or medication as well.
Yeah, I'm glad you brought up the medication piece, because as a trained doctor who used a lot of medication, I have a lot of experience with medication. What I know to be true is that there's two ways you can view medication, right? The negative and the aspect pole as well. And the negative aspect of it is that it is, generally speaking, it's a band-aid solution. It doesn't reverse the root cause. So you're not going to change the condition. You're going to cover it up, right? And you're going to feel better, but you're not going to be better. And the positive aspect of the medication is that for some people, if they don't get to a certain level of feeling better, they won't have the energy or the mindset, they'll be so dragged down by their health condition that they can't even, like, there's no internal resources to rise up, look around and start searching for the solution, right? So there are circumstances where medications are necessary to give you that feeling good, feeling better feeling, so that you can then turn around and take the actions to be better. So I often like to say that the medication is the bridge. It's not the stop sign. It's not like you've got this diagnosis, here's your medication. You're hypothyroid, here's your medication. You're hyperthyroid, here's your treatment plan. You've got menstrual irregularities, here's your oral contraceptive pill. That's not what it is. And oftentimes maybe you don't even need to actually take it. You can just go straight to like the solution, but sometimes you need that bridge to like be able to like get through the situation. But the thing is, you keep walking, you keep going down that journey, right? And this is what Natasha's talking about. And to fix the mindset, I mean, even, right, we're part of like a mastermind kind of group, right, with a wild alumni, wild collective graduates, some alumni. And this is what we're going through. We're like continuously learning more, putting more tools in our toolbox, and just expanding our ability to take on these mindset shifts. It's like going to the gym, but for the mind. We're just exercising our mind. And so sometimes you find that one thing that works for you. Oftentimes it's like you need a little bit of everything. And like I said, it's like a toolbox that you need to be able to pull on. And every circumstance, it might be a different tool that you pull out, right? Like Maybe it is hiring someone. Maybe it is hiring someone to clean your home for you. Maybe it is getting some more childcare in. Maybe it is, and maybe sometimes it's not a money-based solution. Maybe it's like, I just have to see the positive aspect of this and really work. Or maybe you need to have the courage to forgive someone or a circumstance that has happened in your life so you can let it go, because that takes courage to forgive, right? It takes so much courage to forgive. So Natasha, what I want to do now is, as we wind up, I want to ask you 3 questions and you just do rapid fire. And I didn't prepare you for this because I just want to see, like, they're not hard questions, they're fun questions. And I just want to see what comes to mind. So question number 1, what book are you into right now, or would you most highly recommend at this time?
Oh, The Magic of Surrender. I recently read that one, and I'm reading The Untethered Soul right now, which was gifted to me recently. So yeah, it's a kind of an opportunity for mindset change and understanding that surrender is incredibly powerful, especially for a fiery person.
Yes, I know. I love those books. I love those books. What's like your top, like your most recent like health tip or action that you've incorporated into your routine or your daily habits?
I would say an appreciation practice.
Nice, nice
Yeah.
appreciation. I love it.
So
Love it.
appreciation is a bit more difficult than a gratitude practice. It's a bit harder to do. So it's a bit of a love-hate relationship with it right now. I find it really hard, but I love the challenge of appreciation. So that's what I'm spending time with, especially with that heavy side where you have to lift yourself up. It's a nice way to start your day or end your day.
Perfect. Perfect. And what is one thing that you thought was healthy at some point in your life and now you realize was not actually something that is a healthy thing to do or was serving you?
A lot of food choices, I guess. You think that you're eating healthy when you're having some whole foods or you're having a smoothie. A smoothie is one of the things people often are like, I'm so healthy. I have a smoothie in the morning. And a lot of times these things just don't agree with you specifically. So I definitely thought there were things like kombucha or like tomatoes and all of these like sour things that I was eating that was just healthy, but not healthy for me.
Good to know. Yeah. So gaining awareness around foods that are healthy foods, but they're not healthy for your body. And I think that's something that every woman should at some point discover and explore for themselves. That for me was actually my number one, like, foundational thing I had to do to get my health on track, and I had to layer on a lot of other things on top. But if without that, I feel like it's really hard to move forward in the direction that you want to go. So yeah, great. Thank you for bringing that up. And I'm just going to check and see if there's any other questions here. No questions. I think we were amazingly clear. And Donna, thank you for your participation. It was so lovely to see your comments coming in. That was great. And if you're joining this as a replay, please put in your comments underneath. We check and we like to answer things. And if you have any other ideas for future, interviews between Natasha and myself, that came up as a result of what we just talked about, please also put them in the comments and we'll schedule them for the future.
Yeah, and one more thing I wanted to add is to keep an eye out for our East Meets West series, our very first one that we did last fall on the fundamentals will be out very soon for free to view. And we've put together 3 more that are going to be launched later this year, and we're working on some more for this spring. So we're very, very excited to get together to do this, and we hope that you can join us.
Oh, thank you for bringing that up, Natasha. It's a labor of love. It's a collaboration of love. It's actually not labor. It's not hard work when you love to do it. So
It's a lot of fun.
a lot of fun. Well, thank you, everybody. Hope you have a wonderful rest of your day, evening, or night. And thank you, Natasha, for your valuable time and insight and wisdom. Thank you.
Thank you so much, Dr. Patricia. It's such a pleasure to be here with you. I love coming, and you are amazing. Thank you for everything you do.
Mwah. Bye.